Hi, hello, welcome to our second episode. My name's Justin Yannick, this is Maria Lloyd, and this is Catalyst for Healing. So if you want to learn a little bit more about us, maybe go back to the episode before this. Today we're going to talk about one of the more common questions that we both get working in the psychedelic space, and that is, what does it feel like?
Yep.
Right? Would you say that's probably one of the most common questions you get when you talk about
probably
this?
the biggest question because people are always a little afraid, like what's going to happen when we dissociate.
Yeah.
And so I think, we want to go into, what we've maybe noticed and people experience the most, and sharing just in general some experiences that we've noticed are common, and just to help people understand what that actually, because it's really only about 40 minutes, right?
Yeah. Well, yeah, I mean, I think obviously the questions that we get are directed towards ketamine, right? That's the medicine that we kind of work with. Obviously, it's the legal medicine that in the US that we're allowed to provide patients. And so understandably, we're working with a patient population that is oftentimes predisposed to wanting control, right? And so I think naturally this is a question that anyone would have, is like, what does it feel like? But I think even more so for our patients, it's like, I need to know every specific detail so that I can exert my control over the experience so that it doesn't affect me that way, right?
Yeah.
And I think the beauty of ketamine is really to extract the most from it is like relinquishing control, 100%. Which for a lot of our patients which is like the most difficult thing to do, but that the ketamine really does facilitate that process. And a lot of it comes to the preparation that Maria does beforehand to kind of walk them through the experience and how to let go.
Right.
And then the space itself and kind of creating an environment where the individual feels safe to let go. And then hopefully have the experience that they're supposed to have, right?
Yeah.
So let's maybe go a little bit into kind of what it's like when you step into the clinic and when you leave the clinic, because that's kind of like the acute experience. And then we'll go into what you notice the day 2, 3, 4 after the ketamine infusion and kind of the changes that happen there.
One thing I thought of real quick is, so in my experience, and again, the DSM makes us like use these codes for insurance purposes, but nobody falls into a specific category, but they lean more towards one. And so every client with depression has some anxiety. I've never seen just one. Every anxiety patient has a little depression at times. So it's like, but which is their primary? And the reason I think this is funny is because the severe depression clients that I have, they're like, I'm in, because again, there's a level of desperation there when you're feeling so bad.
Yeah, that's true.
The anxious clients have a really hard time.
Very true.
Very hard time letting go, very anxious about what's going to happen. And so I support them differently in the beginning based on what they're dealing with the most.
Yeah, no, I mean, very true.
And you've seen that too.
Absolutely. Yeah, I think big picture, I mean, everyone truly does respond to this differently.